Tiffany Hester. I am the Patient Experience Coordinator and Community Health Coordinator for Titus Regional Medical Center, and I am thrilled you have chosen to join me this afternoon on this live broadcast on March 6th. Thank you for taking your time this afternoon to listen to me. We have a lot of exciting things going on here at Titus and things I'd love to share with you. And first, at the top of my list is to proudly announce that Patty Beckman is our Chief Executive Officer. Patty has been a cornerstone of Titus for the past 9 years, serving as our Chief Operations Officer as well as our Chief Administrative Officer at the clinics of Titus. Her leadership and passion for healthcare has taken us far in our community, and we look forward to her leading us further. We know she will serve us well with her wisdom and strength, and we are looking forward to her leadership. I also want to take a moment to introduce you to our executive leadership team. Second on that list, next to Patty, is Kathy Griffiths. Kathy is our Chief Operations Officer. She has also been our Chief Nursing Officer. Kathy provides unwavering leadership in nursing and will continue to serve us well. Next to Kathy on the slide is Andy Fortenberry. Andy is our Chief Financial Officer. He ensures our financial health at TRMC, and we are fortunate to have Andy on board. Also on this slide is Dr. William Hooks. Dr. Hooks is one of our anesthesiologists. He is also our Chief Medical Officer and Chief Medical Information Officer. He is a great leader to the medical staff team, and his expertise will serve the community well. Also on our slide is Dr. Milan Sekulic, who is one of our cardiologists. He is also the Chief Physician Executive of the clinics of Titus. Dr. Sekulic has a great passion for patient experience and quality of care for Titus, and we are lucky to have him as well. This transition is an important time for us at TRMC, and we could not do that without our physician leaders. They have been instrumental in this process. They have really stepped up. They are leading their teams. They're collaborating with one another in executive leadership, and we are so proud to have them. They are the heartbeat of Titus Regional, and we want to thank you for their continued support during this transition. If you would like to meet members of our executive team, please join me and some of those members every first and third Wednesday of the month at Huey's Coffee here in Mount Pleasant. Huey's is located on 16th Street. If you have not had the pleasure of going to Huey's, you cannot miss it. It is the large coffee shop with a big helicopter on top. I will be at Huey's Wednesday the 19th. is our next coffee chat. This is a great time for you to come, ask questions, voice concerns, give shout outs to where we have served you well. And again, other members of the executive leadership team will be with me, and we look forward to hosting you at Huey's the first and third Wednesday of each month. Next, I want to talk to you about something that is important to me, and that's in understanding the needs of our community. We have launched our Community Health Needs Assessment Survey, and I want to tell you a little bit about what that is. That is a survey that is required by CMS. Every 3 years, we conduct this survey, and it lets us know with your voice where you think we are as a community regarding health and where you would like us to go. This survey gathers information from individual community members as well as hospital employees and healthcare workers. We also reach out to other community leaders throughout this Titus County and surrounding counties. We get your input. We take that input, we analyze that data, and we look at where you really see us needing to go, whether that is access to care, chronic diseases, mental health, whatever those issues are that are important to you. We want to know what those are so we can develop strategies and address those needs for our community. So that's where your voice matters. So I'd like you to take a moment, scan one of these QR codes. They're in English and Spanish. You can access the survey also with one of the links that are shown on this screen. We will be posting those in the chat as well. These links and QR codes can also be found on our social media pages. Our website, you will start to see them popping up at local businesses, maybe in your child's school. But if you would prefer a hard copy of this survey, please stop by our hospital lobby. You can fill out that survey there and return it. It is completely anonymous and your voice does matter to us. So please take a moment to scan one of these QR codes, go to a link, and take the survey. Next, I want to address other issues coming up in March, and it starts tomorrow. Tomorrow is Colorectal Cancer Awareness Day, and we are asking you to wear blue tomorrow to raise awareness. Colon cancer is one of the most preventable and treatable cancers if you are screening and catching it early. So I want you to know that screening saves lives. I just recently, last month, had my colonoscopy, and I can tell you firsthand, it was not bad. It was an easy process. Dr. Alicia Kincaid took me through the process. It was simple, and it was professional and private, and I appreciate her care and the entire team in the GI Lab's care through that process. It gave me a great deal of peace of mind, and I'm glad it's done. So please, I'm asking you to do 3 things. 1, schedule your screening today. It's easy. Get it done. Get it over with. If you're over 45, do it. 2, wear blue tomorrow. Raise awareness for colon cancer. And 3, talk to those around you. Talk to your family. Talk to your friends about the importance of early detection and screening for colon cancer. And that takes us to our next slide. And on March 12th, we will be hosting our Lunch and Learn. If you are not familiar with Lunch and Learn, it is a monthly lunch for our over 55 community that we host at the Mount Pleasant Civic Center. It's a great time. It's a good lunch, and you get to learn something. This month, Surgery Associates at Titus is hosting the lunch. Dr. Beth Peterson and Dr. Marnie Sorensen will be our speakers. Dr. Peterson and Dr. Sorensen are great additions to the Titus family, and we are so proud to have them. They are going to be sharing with you their expertise on robotic-assisted colon surgery as well as other general surgery issues. We would like you to join us, have lunch with us, ask Dr. Peterson and Dr. Sorensen questions, learn something. You might even win a prize. So March 12th from 12 to 1. And next, we would like to remind you that we have a diabetes support group. This group meets the 3rd Tuesday of each month. Their next meeting is March 18th at Titus Fit Cardiac Rehab Center. It's north of the hospital, adjacent to Menadeo Eye Clinic. This group gets together. They talk about controlling their diabetes, things that they have learned, tips. They support one another. They also talk about ways in which they can prevent diabetes-related health issues. This is hosted by Christina Graham. She does a wonderful job. It is at no cost to you, so if you or a family member has diabetes, I encourage you to join this support group. It gives you great information. Go to our website, learn more about it, and join them on the 18th from 4 to 5 p.m. As we tie up March 30th is National Doctors Day, and we want to take a moment to thank the incredible doctors that we have in our organization. They have great expertise, they are dedicated to their field, and they are dedicated to this community, and we are proud to have them on staff here. I also encourage you on the 30th to reach out to your doctor and let he or she know how you feel about them and thank them. I'm sure they would appreciate the shout out, and it means more to them than you probably realize. And finally, please mark your calendars for June 7th, 2025. That is the Titus Regional Medical Foundation's Grand Gala. This year's theme is Out of This World, and we are excited to celebrate this event. It is a night where we get to celebrate, but it is a night that we can also talk about initiatives that we are starting within the organization and raise money for those. Last year's gala, the proceeds benefited our cancer center. We were able to raise enough money to renovate our cancer infusion rooms, giving those patients privacy, a quiet room for themselves and their caregiver to receive treatment. And it has made a world of difference to so many of those patients. But this year, we are celebrating the little ones of our community. We are focusing on our pediatric patients. We believe that the pediatric patient is every bit as important as anybody that comes through our doors. And so we have been working hard on the Pediatric Readiness Initiative in our emergency department. This ensures that children in our area, when they come to our emergency department, will receive the same high-quality level of care that they could receive at a big children's hospital in a metropolitan area. And our proceeds from this year's gala will continue that initiative. And we would also like to renovate our pediatric floor. We want to enhance the amenities of our pediatric rooms, making them more comfortable for both patient and their families. As a mother of a child with complex congenital heart disease, I've spent many weeks in hospital rooms and know just how important those rooms and those amenities are to families, and to be able to provide them the comfort and support in a more welcoming and family atmosphere makes all the difference to the healing process. So I want you to mark those calendars. And we want to invite you, whether you're an individual or a group or a company, to save that date. Watch our websites, watch our social media pages on where you can purchase your tickets, where you can buy a sponsorship. We also are going to accept donations, both monetary and donations to our silent and live auctions. This is an important initiative. It is near and dear to me, so please mark your calendars and come celebrate with us on June 7th. So as we wrap things up this afternoon, I want to thank you for being a wonderful community and supporting Titus Regional Medical Center. You are our voice, and you are the reason we are here, and we thank you so very much. Whether it be from all the things that we have going on, whether we're raising awareness or celebrating our doctors or our new executive leadership team, to making a difference to our pediatric patients. We are excited to be here for you, and thank you for your support. And since St. Patrick's Day is just around the corner, may the luck of the Irish be with you. May you have good health and good fortune. But before you grab that green shirt, do not forget to wear blue tomorrow to raise awareness for colon cancer. Again, I'm Tiffany Hester. Thank you so much for joining me this afternoon. We look forward to seeing you again next month.